it wasn't so long ago that a dear colleague of mine, well-known figure in the field, made the comment. He was not a melanoma physician or specialist.
Mm-hmm.
It made the comment publicly and repeatedly that melanoma gave cancer a bad name. I mean, in other words, it was just one of those cancers that if you were diagnosed in its advanced form, right, that many people, were informed of the treatment options as bad as they were, as ineffective as they were, and chose no therapy, and basically sort of, and that was that. And unfortunately, we still have a couple cancer types that are, kind of in that realm, right,
Yeah.
where we haven't really lifted off the ground in a very meaningful way. I'm not saying that there's no treatment options even for those, but anyway, my point is that melanoma was certainly one of the last cancer types that anyone would have thought that scientific advances would cause this fundamental leapfrogging. I mean, where we've had this quantum step up, where patients with far advanced and just, again, what would have been just horrifically terrifying findings on scan, you get a biopsy result back and you see it's melanoma and you say, hey, we're back in the game. I mean, exactly. I mean, in the way that people have said about lymphoma for quite a long time.
Right.
And so what I'm getting at is, if it's possible in melanoma, I mean, I say this as a melanoma doctor, but many of my colleagues who are not melanoma specialists say this to me also. If it's possible in melanoma, then it's possible in every cancer, right? That we will have these leapfrog moments. And I think, for those who've had a family member with cancer or who themselves have been diagnosed with cancer and are thinking, well, I'm unfortunately in the, end of the spectrum where, big advances haven't been made. What's going to happen? I mean, this is I'm certain of this over the coming, years, pick whatever number you want, 10 years, certainly out to 20 years, is we're just going to keep seeing these big leapfrog moments happening in one cancer type or one molecular subtype of that spreads across 6 or 8 different cancers, right? Where the same therapy basically, produces that leapfrog. PD-1's a bit like that. And so, it's uneven, right? The progress, right? But it's big and, I mean, really, frankly, kind of magnificent. The individual gains that have been made. That's going to keep happening and at a more accelerated rate. I mean, I think it's very, very clear that the windup for this is the technology advance that precedes therapeutic advances. It's coming. What we thought were undruggable targets are becoming druggable from based on numerous types of chemistry advances. The complexity with which cells can be engineered, the way in which antibodies can latch onto 4 things instead of just one. I mean, and deliver payloads. I mean,
chemo with it, and then
exactly, and not just chemo, but immunologic payloads on their back end. I mean, it's really right. The technology advances are astounding, and this again, it makes the prospect of participating in clinical trials just more and more obvious, frankly, right? Because of the access that one gets to these therapies, and there will always be, in the case of melanoma, we have these very, very good treatment options available to us now, but we can improve on them. And participating in a clinical trial, if you've just been diagnosed with melanoma, doesn't mean you're going to have the effective therapy withheld. No, you're going to have a new treatment added to it. Right. I mean, that's the
huge point. It's like we're giving you standard care and we're doing something more to see if there's even a better chance of it happening or less, toxicity.
Exactly.
And that was a great summary. I want to use what you said at the end just all over my social media handles, because I need people. I really just, at the end of the day, want people to be desensitized a little bit to the scare with cancer, just realizing what's out there.
Yep.
To your point, there's the first tissue agnostic. What does that mean? That means we found something that doesn't matter what tumor it is. If it has it, this drug works. I mean, that is unheard of. And I'm still waiting to find one. You've made it through this video, and I am super stoked. Hopefully you feel a lot more knowledgeable and even somewhat comfortable about the crazy world of cancer. If you did, like, comment, but especially just share, if nothing else, to get this information out so that hopefully people are less intimidated by something that's as scary as cancer would be a big win. And we look forward to seeing you here next time.